Today we are learning injury certificate. So why injury certificate? It is one of the most common medical legal document which every doctor or physician has to give. And so it is a compulsory exercise for 13 months in the UG practicals. So one weapon is given to the students and have to prepare hypothetical injury certificate. For example, a person was assaulted by a cricket bat. He sustained three simple and one grievous injury. Prepare hypothetical injury certificates. So you have to write the three simple injuries and one grievous injury. This is the format for the injury certificate, and this kind of table is given to you or you have to prepare. It has these columns. One is serial number, second is the type of injury, third is size in centimeters, then situation over the body, nature of injury, possible kind of weapon, age of injury, and remarks. Most commonly asked question on the injury certificate is the definitions of the injuries. We can easily remember the definition by this table, which is given to you in the examination. So, type of injury, column, size, nature of injury, and possible and kind of weapon. As far as definition considered, we can remember by this from the type of injury, size, and possible or kind of weapon. Any injury can be simple or grievous. We will discuss about the nature of injury later. For example, abrasion. See in the column first, it is the type of injury. Now, its size is by centimeter and it is always in the two dimension and it is called by the hard and blunt weapon. So the definition will be the abrasion is a type of mechanical injury which is two-dimensional and caused by the hard and blunt weapon and in which superficial layer is of the skin is damaged. Similarly, you can remember the contusion, which is also two-dimensional and caused by the hard and blunt weapon. Now, apart from the abrasion and contusion, all the injuries, laceration, incised stab wound, choke wound, are the three-dimensional. So, in the size column, there should come centimeter by centimeter by centimeter. Okay. So, in laceration, it is called the hard and blunt weapon. Now, we come with the sharp weapon injuries. So, incision is three-dimensional, it caused by the sharp weapon. Stab wound is also three-dimensional and it is caused by the sharp weapon pointed weapon. What is the difference between the incision and stab wound? In incision, length of the injury is more than the depth. In stab wound, depth is more than the length. Apart from incision and stab wound, there is other kind of injury which is caused by the sharp and heavy weapon, which is the chop wound, in which there is a more tissue damage is there as it is caused by the sharp and heavy weapon. For the nature of the injury column, there are only two possibilities. One is simple, and other is grievous. So obvious question is what is the grievous hurt? Why your injury is grievous? So for that, IPC section 320 and BNS 114 clear cut given the definition of the injuries. It has the 8 subsections or 8 types of the injuries which are considered as grievous. Apart from these 8, all the injuries are the simple injuries. So these are emasculation, permanent privation of the sight of either eye, permanent privation of the hearing of the either ear, privation of any member or joint, restriction or permanent repairing of the powers of any member or joint, permanent disfiguration of the head or face, fracture or dislocation of bone or tooth, and any hurt which endangers the eye or which causes sufferer to be during the space of 20 days in severe bodily pain or unable to perform his ordinary pursuits. So remember, when you write one grievous injury in your examination, it should come into this 8, one of the 8 possibilities. And the column age of the injury, it is expected from you that you should write the color of the injury and also the time name of the injury. That is, for example, the color is red and injury is from 0 to 12 hours. Now some common mistakes. The example, misplacing type of the injury with the nature of the injury. For example, write the type of injury as a simple and nature of injury as average. Now some common mistakes. The example, misplacing type of the injury with the nature of the injury. For example, write the type of injury as a simple and nature of injury as average. Many students write the type of injury column fracture as a type of injury. Remember friends, fracture can be caused by the any type of the injury. So you should write only abrasion, contusion, laceration, incision, stab wound, and chop wound in this column. As fracture is a grievous injury, you can find this fracture in any type of these injuries after the X-ray or any investigation or by your open eyes. Writing the three-dimensional wounds dimensions, the two dimension. For the example, you write the stab 3 centimeter by 2 centimeter. So it should be 3 centimeter by 2 centimeter by 6 centimeter. This should be similar about the laceration. You have to write the three dimension. For example, 3 centimeter by 1 centimeter is not correct. It should be 3 centimeter by 1 centimeter by 2 centimeter. So when you write or answer about the grievous injury, not every injury is grievous. The injuries which are in the section 320 IPC are only grievous. Okay. For example, students writes only type of injury laceration, say 3 centimeter by 2 centimeter by 2 centimeter or the right side of the forehead, and nature of the injury grievous. So for it should be grievous, it should be in this 8 columns. So when we do the CT scan of the patient, we should write the remarks of demonstration. When we do the CT scan of the patient and frontal bone is fractured, then it can be the grievous injury. Similarly, about the stab wounds, when you write the dimensions and the depth of the injury, when you do the CT scan, or when you do any MRI, CT scan, or USG, and you find any visceral organ damage, then it is grievous. Not all laceration, stab, or chop wounds are grievous. But now you have to answer about the simple and the grievous. Every injury which is the section 320 IPC is grievous on all other than simple.